reporting flu season at high levels right now. Maryland at moderate levels, D.C. at lower levels than in the past year. But with the holidays approaching, I want to make sure everybody stays healthy. Let's talk about some of the health risks when gathering and finding ways that we can all stay healthy. Joining us once again, infectious disease expert Dr. Amesh Adalja. Good morning. Thanks for joining us.
Sure. Thanks for having me.
So, hey, listen, I mean, the bottom line is we're going to be around more people perhaps in the next couple of weeks than we've seen in a while. So, once again, we want to make sure we stay healthy. D.C., Maryland, and Virginia in particular, what are we, I guess, more concerned about?
What we're more concerned about is high-risk individuals getting exposed and getting infected. You have to remember that anytime you socially interact with people, respiratory viruses are sort of part of the equation. You're always going to be getting exposed to them, especially at this time of year. The key thing is making sure that high-risk individuals know about this risk, and if they do get sick, they get promptly linked to treatment. Drugs like Tamiflu for flu or Paxlovid for COVID, so that they're not going to be at risk for those severe complications that we see, like hospitalization, for example.
You know, you hear people talk about, hey, I'm going to take preventative measures, and maybe that's like, I don't know, take an emergency or something like that. Does that, first of all, does it work? And second of all, is it something that we should do preemptively?
Well, I think that people need to think what their individual risk might be for severe disease. And that might then lead to them having an event outdoors instead of indoors if it's weather permitting, or wearing a mask in a crowded congregated indoor area, or having home tests available for COVID, or there's now even home tests for influenza, and then also having a quick hotline to get Tamiflu or to get Paxlovid. Those are the things that you need to remember. And then the biggest thing is, if you're sick, try not to be around other people, or if you have to be around other people, wear a mask.
You know, it's interesting when you talk about the home test now for influenza. Is that one of the, I guess, maybe hidden benefits from what we dealt with for years with COVID? Is now maybe we're just more aware of things like that and testing ourselves perhaps, and maybe staying more aware of not just COVID, but other potential ailments?
That's definitely something that's kind of the long tail of the pandemic, where people became much more aware of respiratory viruses. They're starting to treat them much more seriously. And part of that is treating influenza better. And the home test is one part of that. There's a whole slew of respiratory viruses that we need to get better at dealing with. But I think that is one thing, that now people are much more aware that these are viruses that don't necessarily need to spread as prolifically as they do, and that we have tools that we can use to prevent their spread and prevent their severe consequences. And hopefully this extends from COVID to flu to RSV to other viruses as well, and we get much better at dealing with these things that kind of have haunted us ever since humans started socially interacting.
All right, for some of the big ones, you mentioned COVID, RSV, and flu. Where do we stand on all three right now at this point of the season? Are we at an elevated level compared to maybe past years, or are we about where we've been?
We're like what we were prior to the pandemic years. So with the exception that COVID-19 is part of that mix, and it wasn't before 2020. So flu, RSV, and COVID, all three of them are circulating at high levels. Some in certain parts of the country, some are up, some are down, but they're all at very high levels. I worked yesterday in the hospital, took care of RSV patients. Over the weekend, I was working at a hospital, and I took care of COVID patients. So it just depends on the situation and setting, but all three of those viruses are high very now. So when you see people with coughs and colds, it's likely one of those three, or maybe one of the other viruses that are out there.
Sure. And the last thing for you, because I know you're a working doctor as well as joining us from time to time, which we do appreciate. But if someone is exposed to one of those respiratory illnesses, perhaps over the holidays, typically how long would it take for us to realize that? Is this something that sets in within a day or so after being around people, or the next day, or is it a deferred, maybe like a week later we get the symptoms? What do you typically find?
Usually 2 to 4 days, depending upon which virus it is, how heavy the exposure was. That's when you start to see people come down. But remember, many of these infections can be completely silent. So you could have influenza and not even have any symptoms at all, but yet be contagious. So that's why these viruses are so prolific. They're very good at causing mild illnesses that people don't notice, and they then go on and spread it. So it's really about being vigilant and really protecting high-risk individuals.
All right, it's all great advice, and hopefully we don't come see you. I appreciate talking to you from afar. I don't really want to be in your hospital, so thank you very much. Hopefully others will stay away as well and have a happy holidays. Thanks, Dr. Adalja.
Thanks.
All right. So